now we're going to actually administer SQ fluids. So this is a full bag, so there are 1,000 mLs in here, or 1 liter. So for administration, down to here is 100 mLs, and then the next number is 200, 300, 400, so forth. Each tick in the middle is 50. So if we were going to give 300 mLs, we would go down to the 3. If you, gravity helps you a lot in this situation, so hanging it on the back of a door, and then administering it on the floor, or using a hanger to hang it above a door is very helpful. And then have your pet sit on the ground if it's a larger dog. That's helpful. Sorry, Reese. For administering your fluids, again, you want your bag above your pet, as far above as you can get it, so gravity's helping you. For placement of your SQ fluids, we do it in between the shoulder blades. There's usually a good amount of extra skin in this area for the fluids to dissipate well without causing a lot of tightness to the skin, which can be a little bit uncomfortable. So we usually pick an area between the shoulder blades. And you're going to pick up the skin, the whole area here. Pick up the skin. It's going to make a nice tent. And then you're going to remove your needle. You want this bevel up, so that angled part of the end of the needle should be up. Can you see that? If it's not up, it's not going to be the end of the world. It will just go through the skin a little bit more smoothly, cause a little bit less, cause them to be uncomfortable a little bit less. So you're gonna make your tent, bevel up. You're gonna insert the needle parallel to the spine. Don't go down or up. So just parallel to the spine, just like that. And you're gonna insert it all the way to the hub. So all the way to where the colored part is. And then you're going to find your clamp, and you're going to unclamp it, so roll it upwards, and you can see that it's now flowing nicely here. And just make sure you keep an eye on your bag level, and when we're down to however much you're supposed to give, go ahead and roll this back down, and it'll stop the flow. So once your fluids are administered, so it's good to give treats during this time, some form of distraction. This will usually take more than one person. So now our fluids are all done. We're gonna pinch the area where the needle is, pull this needle straight out, and just keep that area pinched for 15-20 seconds. It's not abnormal for where you inserted the needle to drip some fluid. It might even be a little blood tinged. That's okay, that's not abnormal. It does take 24 hours for those fluids to absorb, and they will move with gravity. So if your pet ends up a little flabby in the chest or the upper arms, that's okay. That's not abnormal, and it will go away within 24 hours. So to cap this needle, you want to put your cap on a flat surface, and then slide your needle in like that.